and thank you everybody for being here this morning. This is a very exciting day for us. I just want to be a part of the discovery of the cure to cancer, ways of treating cancer. So I'm excited for you. I've been aware of this for quite a while, and it's nice to be able to share this with you. This is a hugely important
site network. We will be providing cancer tissue samples under uniform and standardized conditions of genomic analysis of 10,000 very interested in participating in this valuable research program.
In 2011, in Michigan alone, over 20,700 deaths will be attributed to cancer. Using this data, I see a brighter...
The International Genomics Consortium, so you understand what that mouthful is, and I'll refer to it as IGC. It's a non-profit organization, in case you're wondering. And he also conveyed to me a can-do attitude that was special. I've come to know the vision and leadership of the medical staff from the administration to be able to take the Mercy system to the next level. And we went through, as Doug referred to, a one size of protecting them. But those patients and the hospitals that provide those samples are really creating the next wave and the next wave of not only the National Institutes of Health realized from our initiative that this was very doable. They committed to live in the jargon of cancer and what causes cancer. It's really driven by the underlying genetics. That's very important because those are the four basic alphabet allow the world's best scientists and physicians to do that. Again, the linchpin up to this point has been getting pristine samples, high quality care out the patient, then we have failed.
Well, thank you very much, Dr. Penny, and also Dr. Zuniga.
From the patient, we have to have sufficient tissue to do our ordinary diagnostic studies and not interfere with that. If we meet those kind of criteria, virtually any unnecessarily scare people. If it turns out Weimer or one of his other surgical colleagues will send the tissue over to us fresh. We try to identify cases. How many pages is it?
It's about a 6-page consent form. A
6-page consent form. It's gone through our participated in this study. Some of your tissue would be left over, not all of it studied, because it's not needed to be. From that up to the point where it's actually been analyzed in Phoenix or whatever other lab would be involved with it, as soon as we would get word that someone...
300 that were treated with one drug, and 150 of those recur. That's the outcome information that we're looking for. As we then do our work at the IGC to separate out the genetic material, we de-identify it again and ship it out to the centers, and it possibly...
They're paying you for this service?
It's the grant.
If there's anything specific, and we expect to see them, the future diagnostics and therapies that get tied to the Dutch population that is not in the database from other centers that comes from Western Michigan, as well as the other ethnicities. So for that reason,
Aged in a bit quaint, but with a few things. Although there's been some listeria in the cantaloupes lately, I hear. At the time we would get the sample, where the skin is, if that's the margin, the skin of this specimen, we can look under the microscope and see if the tissue has spread and what kind of cancer it is and the rest.